Cirrhosis liver. Liver cirrhosis is mainly characterized by replacement of normal liver tissue by scar tissue. It represented as irreversible and stage disease leading to hepatic failure. Classification: liver cirrhosis. Etiological classification: alcoholic, chronic hepatitis B C, chronic hepatitis C, NAHS, biliary cirrhosis, autoimmune hepatitis. Morphological classification: macronodular, mixed. Etiology: alcoholic liver disease. Alcoholic cirrhosis develop in the individual to consume alcohol routine for several years. Alcohol injury the liver by blocking the normal metabolism of protein, fat and carbohydrate. The injury takes place due to formation of aldehyde from alcohol. It leads to further damage. Chronic hepatitis B and C. Chronic viral hepatitis is one of the leading causes in development of end-stage liver cirrhosis. Non-alcoholic steatohepatitis (NAHS). In NAHS, the fat builds up in the liver, which eventually causes scar tissue. This type of hepatitis is seen in patients with obesity, diabetes mellitus, coronary artery diseases, etc. Primary biliary cirrhosis. Damage to the bile duct may cause secondary liver damage, leading to accumulation of metabolites and scarring of liver tissue. Autoimmune hepatitis. It is caused due to immunological damage to the liver, cause its inflammation and scarring of cirrhosis. Morphological type. Depending upon the size of nodule, it is divided into micronodular cirrhosis, which has nodule size below millimeter. Macronodular cirrhosis. Here the nodule size are larger than 3 mm. Mixed cirrhosis. Here the nodule of above both type are seen. Pathogenesis. Liver play an important role in metabolism, detoxification and storage of various metabolism. Cirrhosis often short and hepatitis lead to following changes. Fibrosis. Due to continuous destruction of hepatocytes, it is cause collapse of normal hepatitis parenchyma followed by fibrosis around the necrotic liver cell. Regenerative nodule. The surviving hepatocyte act as stimulant for the growth and proliferation more new hepatocyte. With the help of several growth factors, this compensatory proliferation of hepatocyte is restriction by the fibrosis tissue, leading to formation of generation of nodule, various deorganization. Due to above two pathogenic changes is damage hepatic parenchyma due to fibrosis, formation of hepatic nodule. The blood vessel now, instead of draining the hepatitis cell, directly drain into the hepatitis vein, leading to further shrinkage of the liver tissue. Clinical feature. Cirrhotic changes usually remain asymptomatic over a long period of time due to the compensatory mechanism. Sign and symptom due to failure of liver cell include generalized weakness, yellowish skin, clumping of nail, spider nerve, gynecomastia, ascites, testicular atrophy, bleeding form of dilated vessel in esophagus and stomach, swelling in the lower limb. Hematological investigations. Serum bilirubin. Its level are normal when compensated but may elevate as the cirrhosis progresses. Increase in SGOT, increase in SGPT, increase in alkaline phosphate. Liver biopsy. It is gold standard method for confirm diagnosis of liver cirrhosis. Microscopic appearance may show appearance of fibrosis or presence of regenerating nodules. Radiographic imaging. It may show shrunken nodule liver in advanced cirrhosis. Various measures used are ultrasonography, CT scan, and MRI. Treatment. Generalized liver damage, which is caused from cirrhosis, cannot be cured by the proper treatment called help to stop the progress of disease and its complication. Liver transplantation can be considered in case of the end stage of hepatic failure. Prevention: avoid intake of alcohol, vaccination against the hepatitis B virus, proper eating habit maintain. Metabolic cause of liver tissue damage.